Today we're going to be talking about mood disorders on DSM-VI-DEO. Now that's the Will It Blend theme song. Fortunately, we didn't have a composer to do the little theme song for DSM-VI-DEO. So, major depressive disorder, that would be 19. It's defined as symptoms of major depressive disorder, primarily severely depressed mood and a loss of interest or pleasure in everyday activities, accompanied by other symptoms such as feelings of worthlessness, hopelessness, anxiety, problems concentrating, thoughts or maybe attempts at suicide. Symptoms may include loss of interest, change in eating, appetite or weight, changes in sleep, decreased motor activity, fatigue, loss of concentration, thoughts of suicide. Treatments for a major depressive episode may be from mental health specialists that focus on a lot of different things. There's a lot of mental health centers or organizations for depression. Hospitals, outpatient clinics, social service agencies, private clinics, peer support groups, clergy, and employee assistance programs. Psychotherapy alone, antidepressant as medication. There's a lot of different things. Research has found that about 20% of these episodes can last 2 or more years, but half of depressive episodes just end spontaneously. However, even after the major depressive episode is over, 20 to 30% of patients have residual symptoms, which can be distressing and associated with disability. Hypomanic episodes, that would be 20. Boom, boom. Hypomania is a less severe form. Hypomania is a mood that you don't perceive as a problem. Actually may feel pretty good. You have a greater sense of well-being and productivity. However, for someone with bipolar disorder, hypomania can evolve into mania or can switch into a serious depression. Symptoms. Symptoms may include needing less sleep in order to feel rested, talking very rapidly or excessively, being distractible, having your cat show up at bad times. Treatment for bipolar disorder often includes getting rid of your cat and they don't stand on your keyboard of your computer. Includes a combination of mood stabilizing drug and psychotherapy. Often drug treatment is primary with ongoing psychotherapy as secondary, but some believe that would be better if it was switched. The recommended treatments for bipolar depression may include lithium, anticonvulsant, and antipsychotic medication, or a combination of any of these medications, depending on really what's going to work. Maybe it's just a cocktail for a lot of people, and maybe that's not the best thing. Major depressive episode, 21. Constant sense of hopelessness and despair is a sign you may have major depression, also known as clinical depression. This is more than just an episode, it is a disorder. Fatigue almost every day, feelings of worthlessness or guilt, impaired concentration and decisiveness. Treatment includes antidepressants, SSRIs, most commonly prescribed. It can help brain circuits that make more effective use of serotonin. Current research has found certain foods, such as turkey, nuts, carrots, shellfish, coffee, and milk can all help prevent depression, interestingly. Moving on to 22. It's whole iron. Defined as a chronically depressed mood. This is persistent depressive disorder, by the way. Also known as dysthymia. Lasting at least 2 years. Oh, my cat just sneezed. That's disgusting. Okay, it's everywhere. Get down. Go on. Okay, symptoms include loss of interest in daily activities, sadness, emptiness, or feeling down. Oh, Claude! eyes. Ow. Go on. Go away. Trouble concentrating or trouble making decisions, irritability or excessive anger. Treatments, SSRIs, tricyclical antidepressants, serotonin, as well as a myriad of psychotherapy. Current research has found that neurotransmitters are naturally occurring brain chemicals that like play a role in depression. I think we've known this for a little while. It's not exactly current, but changes in the function effect of these neurotransmitters and how they interact with neurocircuits involving maintaining mood stability is really going to play a significant role in moving forward and figuring out how to deal with this. How to deal with the cat. Almost done here. I'm going to get rid of it. So 23, we got double depression. Double depression is a condition that occurs when an individual is suffering from mild depression and then moves into a major depressive state. Symptoms include loss of interest in daily activities, tiredness, trouble concentrating, decreased activity, a lot of the same ones that are that go along with other depression. The treatment is really a lot of the same. SSRI. Experts recommend starting on one approach, either cognitive therapy or an antidepressant for a few months and watching its effect, and then moving on and see what's going to work, combining them. It's really kind of just a combination, kind of a recipe of what's going to work for one person. Ow! Okay, almost done here. So, 24. Got premenstrual dysphoric disorder. PMDD is a severe and sometimes it's disabling extension of premenstrual syndrome. It can have really physical and emotional symptoms, often leading to depression or extreme mood shifts, disrupting your work and damaging relationships. With PMDD, symptoms usually begin 7 to 10 days before your period starts, continue for the first 2 days. It can cause bloating, breast tenderness, fatigue, and changes in sleeping and eating habits. Treatment includes antidepressants, birth control pills to kind of regulate some of the hormonal fluctuations, herbal remedies, and diet changes. Current research, the cause of PMD isn't clear. Underlying depression and anxiety are both common, so it's possible that the hormonal changes that trigger a menstrual period worsen the symptoms of a mood disorder. So maybe trying to regulate those hormonal changes is most effective. So our last one in the mood disorders, we have 25. Disruptive mood dysregulation disorder. DMDD is a psychoactive disorder in children, characterized by persistently irritable or angry mood with some severe outbursts. It's classified as a mood disorder. These children are at risk for depression. Symptoms: children may scream or yell. They throw objects, hit or slap or bite, destroy things. Treatment: there's not a lot. Several cognitive behavioral interventions have been developed. Research is showing that evidence is really weak for treatment. Some physicians have used lithium to treat DMDD, although it has not been shown to be better than placebo in alleviating the signs and symptoms. So that's all of the mood disorders. Thanks for watching DSM video. Bye-bye for now. For me and my cat. Just waving goodbye. This cat has a little bit of a disorder of its own. Maybe some trauma from childhood or something, I don't know. Anyway, thanks. And I'll see you next time on DSM video.